This meeting is being live streamed. So that's showing up on my Zoom feed here.
Okay.
Meeting is being live streamed. That's showing up on my Zoom feed here.
Okay.
I think the question is,
Oh, it says on oh no, it's a different one.
showing up on my Zoom feed here.
Okay.
Is there a way to grab the link to know if it's the right one?
Oh, it says on oh no, it's a different one.
Showing up on my Zoom feed here.
Okay.
Share. We grab the link to know if it's the right one.
Oh, it says on oh no, it's a different one.
Hmm.
Okay.
Share. We grab the link to know if it's the right one.
Oh, it says on oh no, it's a different one.
We're getting that echo here. Let me
So
turn
I
it-
just
let me turn it
opened
off.
the YouTube and I am seeing it.
You are seeing it?
Oh, it says
Who's
Yeah,
Dorothy? You're seeing,
there's a slight delay.
and Dorothy, you're seeing it on the link that we provided to people?
Oh no, I just pulled up the results YouTube channel. Let me check the link.
And I was looking for this. That's in terms of what's the link end with? Yeah, doesn't look like the same link.
I think if we shared a link that was like to the pre-event on our YouTube, it might be working.
I'm not sure how to get into, I mean, the stuff is pasted into the Zoom.
Okay, so I just opened the link from the event page and it took me to the results YouTube channel page, and this live stream is the first thing that you can click on.
Oh, okay. So is that, Deborah, is that what we want? Is that good enough?
I think that's good.
There is another one that's listed below, but it doesn't show it started, whereas it says this one is live, and so I think people will click on it.
Well, if we get a slide up, I haven't downloaded the slides from the, but I could go out and grab a slide and share it on my screen.
And I've added the slide to the deck. So I don't know if
Okay.
that's helpful.
Great. You have it, do you have, and I can go find it too, but do you have a link to that?
Yeah, let me share that in the chat.
Yeah, throw it in the chat and then I'll pull it up here. I'll stop this sharing here and I'll get that up, and then we'll see what things look like out there. Let me download this guy real quick. Thanks for doing that too.
Oh, that's a good idea, Dorothy. I'll tweet out. She just messaged me. I'll tweet out the link to directly to this one. Can't hurt.
I will have this up momentarily.
I'm gonna grab a water, but I'll be right back.
Okay. All right. Excellent. Let me do this.
Perfect.
That's showing up there?
Yeah. Looks good.
Ha. It's also showing me, which I don't really need to see happen. Maybe I'll sure turn my video off here. There we go. All right.
So I guess in the future, we should just share the link to our YouTube live page and then we don't have to worry about the direct link.
Now that sounds good.
Okay.
Looks like we're pretty darn close here. I can, we'll wait a few minutes here and then I can let folks in the waiting room.
Mhm.
And then we can just kind of, again, kind of open things up for people chit chatting. They'll know it's live out there and all that stuff. Does that sound okay to folks?
Sure. Do you need me for anything else besides this tweet?
I don't think so. It's provided that this streaming thing continues to go well. I think we'll be okay.
Well, I'll have Skype open on my phone, so just Skype me if anything, if you need anything.
That sounds great.
Silly question, but does it automatically stop when we close the webinar? I guess it does. Like, there's no off switch, right?
I would assume because
What is it going to keep streaming if you close it?
Right, okay. All right.
It's a good question, though.
You never know with technology. Thank you, Deborah.
Yep. Thank
Yeah,
you, guys.
really
Bye.
appreciate it. All right, how's everybody else feeling?
Pretty good. Are any of the speakers in the waiting room by chance?
Let's look here.
Oh, Anne is on.
Awesome.
Let her in.
Are you got that, do you, Karen?
I just let her
We
in.
should add our captioners too.
Where's our captioner?
I got those.
Okay, thank you.
Okay, so who's running the slides?
Right now, I've got the slides up and
Could we maybe switch then, Ken, since
I don't know because I'm broadcasting live, and so if we switch it, well, I guess
That's fine. If you
It's
want to
from
go ahead and
the
do it, Ken, the prompts are in the agenda.
Yeah, so for the part where you're spotlighting Ken, there won't be any slides. So it's like maybe I think it will work like this if you show them.
Yeah, and it should. I mean, if they're broadcasting the webinar, it shouldn't matter who's showing them, frankly. So, Josh, you should be able to show
And
Are you-
hi, welcome, Anne. We're just figuring out the last sort of technical tests that we need to do. But we see your camera.
Sounds great.
Clear.
Thank you.
And yeah,
Good
you
to
sound
see you,
great.
Ann.
Great.
Thank you so much for being with us on a Saturday.
No, it's exciting to be here. So thank you.
We do
Ken,
one
do you
more.
want to stop sharing your slides?
Yeah, I'll stop sharing mine, and then do you have that opening slide that on your deck? Did you just download it, or you got it online?
I mean, yeah, I've got this slide, yeah.
Okay, let me stop sharing, and then I'm just going to do a quick check-in with the captioners here. Hi, welcome captioners. Which one of you should I be assigning to the live captioning?
Either or, thank you.
All right, 1 second here. We'll get you going here. Should be all set.
Thank you very much.
You bet.
Can you see the slides?
Yes.
Yeah.
Okay.
It was Maybe I'll wait till like 5 till or something like that, and then we'll let everybody in and give them a chance to chat or whatever it may be. Let me look at the live stream, and that looks good too. Yeah.
Awesome. Just let me know if you see Hilda or Deborah in the waiting room.
Will do. Just let Keisha in. So Anne, where are you joining us from?
I'm in Antigua, Guatemala.
Well, thank you for joining us from so far away. Really appreciate
Yes.
it.
It's an honor to be here.
Seems like a pretty exciting program today.
It does.
Okay, I just retweeted to all my 34 followers. So if we see massive traffic, we'll know.
Welcome, Joanne, too. I'm glad to have you on the line here.
Thanks. Can you hear me okay?
Yeah, you sound great.
Hi, this is Deborah checking in.
Hey, Deborah.
How are you?
Good.
Just
Very
wanted
good.
to
Welcome.
correct my name. It seems to have come up as LASH.
Yes, I saw two
Oh, there
Deborah
it is.
Lashes on there. And Deborah Lash is like our communications guru here. So I was a little confused. So glad you corrected that. Let me promote
Okay,
you
good.
also.
I've had to be careful not to email the wrong person because
Oh,
we
isn't that
also
funny?
do first initial last name.
Right. Yeah. That's funny because I was thinking it was a typo, but that's even, more interesting. Just
So,
wanted to say I've joined on 2 devices just in case of anything.
okay, great. So that's the other Deborah Lash.
Yes. Right.
All right. Very good. Very good.
Yeah, thanks so much for being with us. It's really great to have you.
Yeah, very happy to be here. Okay, great.
And
You renamed
for,
me.
for you folks who are speaking today, too, just an FYI, I am making you all co-host, which means you can mute and unmute yourself. So we're going to remove that capability for other participants. So, but you'll be able to do that yourselves. So I'm going to have people stay muted on as they're entering and then not necessarily having a bunch of chit chat. So We'll just kind of let folks know things will start soon, but I'm gonna go ahead and let folks in at this point. Welcome, everybody. We'll get started at the top of the hour. Really glad that you're joining us up today for our national webinar. Dorothy, are you kicking things off? Let me look at the agenda here. No, actually, Joanne's kicking things off. So Joanne, we'll go as we normally do. We'll spotlight you and hit the record button, and then you should be good to go.
Great, thanks.
Welcome, everybody. We'll be getting started here momentarily. I'm looking forward to a fantastic webinar today. So just hang in there and we'll get started soon. Hey there, Oscar, and welcome. Yeah, feel free to say hi to folks you see in your windows as you look across the country in the chat. Nice to see you in Raleigh, Liz. Welcome, Laverne. Hello, America. Hey, Paul. Nice seeing everybody. Hey, Richard. Nice to see you too. Welcome, Judy. Hey, David. Welcome from Minnesota, Teresa. Oh, it's nice that Tiffany and Jacoby are together out in Oklahoma. Great. Hey, Brazil. Massachusetts, okay. Got people from all over the place. Hey, Leslie, welcome. Kathy, welcome as well. Let's see if Hilda has joined us yet. Not yet. All right, Joanne, I'm gonna, you can go ahead and turn your video on. I'm gonna hit the record button and then I will,
And you can hear me okay?
yep, you sound great.
Welcome, everyone. I'm Joanne Carter, Executive Director of Results, and I'm so grateful to be with you all today. As many of you know, next Friday is International Women's Day, and today we're going to hear from some amazing experts focused on women and children's health in honor of this day that's focused on both the contributions of women and girls, but also the structural barriers to their full inclusion and equitable access to resources. First, though, I know many of you are joining us for your very first results webinar. So I want to extend a special welcome to new advocates and partners on the line today, including key partners from Together Women Rise, and also a shout out to the groups and volunteers who invited new folks to join us. This really is the core of our Community of Change campaign, to build our network and build our collective power. And thank you to so many of you who've been pushing day in and day out for critical action now from the Senate to expand access to the child tax credit for millions of US families with low incomes, and also to drive our entire agenda this year. We have set the ambitious goal as part of this Community of Change campaign to meet with every congressional office covered by results between now and April. And just imagine the impact over 350 meetings in the next 3 months could have to drive action on nutrition and global child health and economic justice in the tax code. So thank you all so much for being here. And I know many of you have joined us because you are passionate about the rights and health of women and girls, and how impoverishment, gender oppression, conflict, and humanitarian crises connect. And those intersections are what we're going to be talking about today. And I know as we're thinking about how women and children are disproportionately impacted by conflict and impoverishment, many of us have the horrific and escalating events in Gaza top of mind. So I'll touch on how the violence in Gaza is specifically affecting women and children in a few minutes. But I first want to reiterate Results' call for a ceasefire and an end to the horrendous violence. Gazan civilians must be allowed to access direly needed humanitarian aid. So we continue to join the call for an end to the siege, no ground invasion in Rafah, scaling up safe and urgent delivery of essential food and medical aid, and the release of all hostages. Women everywhere have the human right to equitable, quality health care, but far too often they don't receive it. And that's in communities across the US and around the world, and often driven by racism, colonialism, and more. And there are also profound and generational impacts of women's health for the whole community. Multiple studies the world over have shown that the most accurate predictor of a child's health is the health of their mother. And yet we are falling short in alarming ways, both here in the US and globally. And when it comes to those in conflict zones with pervasive poverty, the situation is even more desperate. The conflict in Sudan has created the world's largest displacement crisis. And of the 500,000 children who've been forced to flee into Chad in the last year, 40% are severely malnourished. The World Health Organization considers 15% to be an emergency threshold. And again, when we think about health crises at the intersection of impoverishment and conflict, the dire situation in Gaza is there for all of us. So again, as I said, we've called for a ceasefire and opposing a ground invasion of Rafah by the Israeli military, increased humanitarian aid now, and the release of all hostages. Rafah is perhaps the last remaining Gazan city with any basic services like running water and hospitals. 1 million or more civilians are sheltering there, and women and children are bearing the brunt of this catastrophe. One obstetrician who recently returned from Gaza told The New Yorker that maternal health care has all but disappeared. Not a single pregnant woman she encountered had seen a doctor since the war started. And a joint assessment by the United Nations agencies found that at least 90 90% of children under 5 are affected by one or more infectious diseases. And even beyond the humanitarian catastrophe of conflict and other acute crises, around the world, we know that women living in the most impoverished communities are routinely denied access to quality health care. Millions are forced to go without prenatal care or emergency care in their delivery. Adolescent girls without access to the HPV vaccine, which is life-saving protection against the threat of cervical cancer, or access to reproductive health care. Astronomical rates of debilitating and sometimes deadly anemia in women globally. Being anemic during pregnancy increases the likelihood of giving birth prematurely and of dying in childbirth from hemorrhage. As advocates, we know we have made enormous progress in areas like child health, HIV, and more. But women and adolescent health does lag. But for these and so many other challenges, we already have the strategies that can make a profound difference if they're equitably available, including primary health care and other basic rights, and social support for every family. As advocates, we can and must push for these policies and funding to make this possible. But first, we also need to listen, to follow the leadership of directly affected communities to shape our policy priorities and drive the focus and strategy. And this is true for our US policy work and our global advocacy. We need to listen to the women and girls long denied their full rights and to the community health leaders working to support them. As advocates, we use our voice alongside them in their calls for change and justice. So I'm so excited for our upcoming panel discussion. And I encourage you to listen to this conversation and think about how it applies to your own advocacy as we get ready to push the US government to fund maternal and child health and nutrition, access to vaccines, and more. And just before turning over, I just want to say a bit about language. In acknowledgement of International Women's Day, we'll be focusing especially on the long-standing oppression faced by people who identify as women and girls. So, for example, we'll often refer to the health of a birthing parent as maternal health. But at the same time, we know that the social construct of gender also harms many who hold identities along the full gender spectrum, including non-binary and transgender people. So today's discussion won't do justice to the full scope of gender oppression, but I just wanted to acknowledge this before moving forward. So now to get started, I will hand over the mic to my wonderful colleague, Dorothy Monza. Dorothy is the Global Policy Manager for Nutrition and Child Health here at Results. She serves as co-chair for the Maternal and Child Health Roundtable, which is the leading coalition focused on these issues with the US government. She's also on the steering group of Scaling Up Nutrition Civil Society Network, which brings together over 4,000 members in 50 countries. So Dorothy, thank you so much for hosting this important panel, and over to you. Thanks.
Thank you so much, Joanne, for that amazing opening and really helping set the stage for this conversation. I'm so excited to be here with you all today and to see already over 130 people have called in to be part of this conversation. In my job at Results, I have the privilege of getting to work not only with the amazing grassroots network, donors, supporters, friends of Results, but also international partners and other organizations who are as committed to addressing these issues as we are. Oftentimes in our advocacy, we are focused on what is the pressing need now where a grassroots voice can make a difference. And so often, we're getting in the weeds of, this is the moment to make change on this bill, or this is our ask for this particular line item of the US federal budget. And that advocacy has been incredibly successful over the past 40 years. And that sort of deepness of relationships and specificity is really important for moving the needle on these issues. But we also know that, issues of poverty and health are embedded in society overall. And we're really excited to take the opportunity to broaden this conversation out a bit. And before we sort of get into our budget advocacy and our appropriations advocacy for the year, really grounding ourselves in our values and why these issues are so important to us, why they are important issues of poverty, but also how we as results advocates can be in solidarity, as Joanne said, with other movements, but specifically with affected communities and those who are working alongside them. So I'm really excited to be kicking off the conversation with two amazing panelists who are here with us right now. And feel free to turn on your cameras as I go, but I'm really excited to have Ann Kramer, who is CEO of Maya Health Alliance. Ann is an anthropologist and co-founder of Maya Health Alliance. And her passion is amplifying the voices of women and girls to foster community-driven, high-impact, cultural, and linguistically appropriate programs that will promote health and reproductive rights in underserved communities, particularly Maya Indigenous communities. So we're so excited to have you here, Ann. We're also joined by Dr. Deborah Ashe, who has more than 20 years of professional and human development, capacity building, policy, and research experience. She is with FHI Solutions and is an experienced project manager and researcher who's really been driving a key piece of work on the gender nutrition gap, which we can't wait to hear from you, Dr. Ashe. So I think and we also are joined by Hilda Kwesi, who is the advocacy officer with Health Promotion Tanzania. HDT Tanzania is a member of the Action Global Health Partnership alongside Results. Hilda is a nurse midwife with 9 years of experience working alongside reproductive, maternal, and newborn health projects, and is leading and managing the advocacy portfolio of that for HDT Tanzania and really leading up work with the Tanzanian government. So thank you so much for being here with us, all three of you. And we can go ahead and kick it off. So first, I would love to hear a little bit about each of you, and then we'll go to some other questions on what really, as advocates in the US, the key messages we need to know. But I would love to start with you, Ann, and to hear, we know that Maya Health Alliance, you've been really intentional in building bridges and access to healthcare in rural and indigenous communities in Guatemala. Can you share a bit more about that work and how it's led to lasting improvements in community health?
Yes, thank you so much, Dorothy, for welcoming me and for having me today. It's a pleasure to be here. I think it's really key, the work that all of you are doing, and for inviting us today and really focusing on women and girls. In our work in Guatemala, we are really aiming at transforming health for rural communities, and we do that by being community-led. Well, I am from the United States. I've spent over 20 years in Guatemala, and I think something that is really key about the work that we're doing is all of our community health workers, the doctors, the nurses that we have working on our team, over 80% of them are Indigenous women. And that is really key to the work that we're doing. I think something that sometimes people think about healthcare is that we just give out medications and that we're just providing access to care, but we're doing more than that. We're community building, because without being able to work within the Indigenous communities, without understanding how they're built, without understanding all of the barriers that women and children, especially young girls, face in accessing care, we can't do our work. And by hiring local community members who understand these barriers and can help other women overcome those barriers, I think that's absolutely key in the work that we're doing. In Guatemala, oftentimes what you can understand about the country is that while it is one of the wealthiest countries in Central America, it is actually one of the most unequal countries in the world. And women and girls, Indigenous women and girls, shoulder the brunt, really, of this poverty. They have barriers such as distance, cost, languages. There's over 20 different languages spoken in Guatemala, and many times women and girls speak Mayan languages and not Spanish, while all of the health services are provided in Spanish. And so we work really hard. We work in 6 different languages in order to provide care and access for women and girls to have services in their language. We believe it's really important to provide healthcare around understanding for women and girls. And a quick kind of understanding of one of our programs is really specific on maternal health and helping better infant outcomes. And what we've done is we've created a cell phone app that we provide with traditional Kaqchikel Maya midwives. And that that application speaks in their language. And it's a very easy application for women who are serving other women in their communities to identify high-risk pregnancies. And what we found is that when a midwife can identify this high-risk pregnancy, when she cannot birth at home, she can send that woman to the hospital. However, we had to overcome another barrier that many women don't want to go to the hospital because they're scared. They've actually told me, I'd rather die at home than go to the hospital because they don't treat me well there. They don't speak my language. I'm scared to go. So we've created care navigators that speak the language of the women in the hospitals. So basically, we've created this link that helps empower Indigenous midwives to care for their patient, send them to the hospital, and have a care navigator there to advocate for her in the hospital. And we're glad to see that we've been lowering maternal deaths in the region that we've been working, serving over 1,000 births a year, which is really vital. And if we're not providing this care for women, we're not just losing one mom, we're losing an entire community. And I think that's what's so important, is that a maternal death hits so many lives in a community. And so that's just some of the work that we're doing, but it's absolutely vital to have community health workers that are local women who speak the language and understand the culture of the people that they're serving.
That's amazing, Anne. It's so great to hear about the work that community health workers and midwives are really driving in Guatemala. My next question is for Hilda. You're leading HDT Tanzania's advocacy work on maternal and newborn health. We would love to hear more about the work that you're doing in your advocacy with the government, and how is gender important or showing up in that advocacy?
Thank you very much, Doloth, for the opportunity. So I appreciate. So on behalf of HDT, so in our advocacy health advocacy portfolio, we are doing some activities together with government in collaborations, and we are normally work closely with the Minister of Health, Minister of Education, and Minister of Industry and Trade, depending on the projects that we are leading so far. So on some of the projects, we are supporting government on data evaluations or data analysis on RMNCH, reproductive, maternal, newborn, and child health plus nutrition. So we are doing analysis on behalf of the government to see the trend of the regional, of the national level. What is the trend of reproductive maternal? What is the trend of neonatal death? What is the trend of the maternal mortality? So depending on that abstract or brief, we are supporting government on defining or come up with the appropriate interventions depending on the region that have a low or have a poor number of the indicators. So that is one. Number two, we are working together with the government in making sure that we are supporting women's and adolescents on nutrition. Especially our focus on nutrition is on food fortifications. So we are trying to advise or to advocate so that we have enough premix for all vehicles for food fortifications like wheat flour, maize, salt, and oil. So we are advising government and working together to make sure that the regulations and policies are there, and we are following the policies and regulations as per standards. And also we have another thing that we are doing is on the human-centered design. We are putting community at the center. So we are developing solutions with community, especially for the adolescent boys and girls living with HIVs, and also healthcare providers who are providing healthcare services to the community. So we developed some of the solutions, like if you feel like this, what are you going to do? It's some filling posters, one, and number two is booklets for the transition from the adolescent group to the adulthood group, so that they will have there with the the treatments, and we are not losing them in between. And also, we are working on TB, tuberculosis, and on that, we managed to help government to develop a multi-sectoral accountability framework for TB response in Tanzania. So we are just trying to coordinate different ministries from different angles so that we can have the same understanding and the same approaches on ending tuberculosis in Tanzania. So we managed to develop the framework, and now we are working closely with all 26 ministries in the government to make sure that we are ending TB by 2030. So how is gender important or showing up in our advocacy? Normally, we don't want to leave anyone behind in our project. So we are trying our best to, for those projects that we have a project on family planning, and we know that it's very challenging to include male involvement is very low, especially in family planning intake or family planning uptake in a certain region or a certain area. So we are trying our best to make sure that the group of male also, they are involved in making the appropriate choice for them and for their women's or for their wives or for their mothers. So male involvement and also inclusiveness, especially on the nutrition. We believe that in gender, and it's very important to include children, depending on the fact that they are affected by the under 5 are more affected by the stunting and micronutrients deficiency, depending on their age. So we want to make sure that we are inclusive of them. And also for adolescent girls and women, we are also trying our best to include them in our projects so that they will benefit from what we are advocating for. So for the gender inclusiveness, we are making sure that we are leaving no one behind in our projects. It's depending on what the key areas or key group of people who are left behind. So we're just trying to bring that group on board and work with them closely. So thank you.
Thank you, Hilda. It's always amazing to hear about the work that you're doing with the government and with the communities. And I love that you brought up the importance of the involvement of men and how gender doesn't only mean, you know, things to do with women or women's issues off in their own corner, but that it's really a problem for the whole family, the whole community, the whole society. Now I want to go over to Dr. Ash, who has really been really involved in leading a key piece of work looking at the gap in women's nutrition specifically. And so, Dr. Ash, we would love to hear more about you and your work at FHI Solutions, and especially if you could share a bit more about the Gender Nutrition Gap Report and the framing of nutrition as a women's rights issue.
Great. Thank you so much, Dorothy and the results team and my fellow panelists. I'm very happy to be here. Thank you for the opportunity to share what we've been doing with a large group of partners to co-create this Closing the Gender Nutrition Gap. And this is an action agenda for women and girls. And so before I tell you about how that action agenda has shaped up, I'd like to call attention for this group for a very important resource for all of us that many of you may have already seen. Last year, there was a flagship report published by UNICEF, and for the very first time, we have seen a global database on women's nutrition coming from 190 countries. So this is a very important resource for all of us. And the title of the report really tells us the story of what this report is all about. And it's called Undernourished and Overlooked, a Global Nutrition Crisis in Adolescent Girls and Women. And again, this is the first time that this information has been compiled all in one place. And it gives us a very comprehensive view of what is causing this pervasive malnutrition, tells us about the impact this is having on everyday lives, in families and societies, and as well leads us to evidence-based recommendations. So I thought it would be useful for today's webinar to run through some of those key findings that sharply highlight why we were motivated and why this whole group was motivated to come together to come up with this gender nutrition gap action agenda. So a couple of the key important things to keep in mind, statistics to keep in mind, is that progress on adolescent girls and women's nutrition is too slow and under threat. And this is a very important conclusion from this report. And just as a reminder, we know that 69% of adolescent girls and women suffer from micronutrient deficiencies. So again, to keep in mind the magnitude of what we're talking about here. And also that overall, at least 1 billion, that means 2/3 of adolescent girls and women are affected by undernutrition, anemia, and or other micronutrient deficiencies. So that combined effect leads us to 1 billion who are affected by this. Again, a very important statistic to keep in mind as we make our actions in this area. The next one is that we know from this report that the global food crisis is deepening for adolescent girls and women. So we know overall what we've been seeing and experiencing is a very significant, unfortunately, decline in the global food crisis, but it's disproportionately affecting adolescent girls and women. And in 2019, there were 49 million more women suffering food insecurity than men. And then in 2021, we have seen that this gender gap increased to 126 million. So again, a very significant and disturbing uptick in the food crisis for girls and women. And another thing to keep in mind is that where we're seeing all of this is in poorer regions and disadvantaged adolescent girls and women are bearing the brunt of this undernutrition and anemia, and particularly in South Asia and sub-Saharan Africa. And this is where we are seeing 68% of adolescent girls and women who are underweight, 60% of adolescent girls and women who have anemia. And a very important point is that less educated girls and women and those living in rural areas or belonging to poor households are more likely to be underweight, too short, and or anemic. And then the final point in terms of the background statistics of all of this is that, just to recall, as many of us do know, that poor nutrition is passed down through generations. And so we're talking about the girls and women who are affected by this right now, but remember, this is a long-term view. And we also know that there is a critical window to act. And so what we're seeing and how this links to a lot of the action that we see to reduce undernutrition is that globally, 51 million children under 2 years of age are stunted. And again, that is an intergenerational effect. And undernutrition continues to play a role in around 45% of deaths in children under 5 years of age. So while we're talking about girls and women in their own right, we're also talking about what kind of generational effect this has across society. And so what we understand from all of this is that there's a pervasive, what we call a gender nutrition gap. And this is affecting girls and women in a much, much more disproportionate and substantial way. And so what we did together as a group of organizations, we realized we had to come up also with a way of understanding this and a narrative that is helpful to be able to talk about this. And so where we landed on the most simple definition of this gender nutrition gap is that we're talking about the way in which women and girls' unique biological needs, the disparities in access to food and services, and harmful and social norms all have a bearing on their health and economic outcomes, including empowerment. And that's really a very important part of that brief definition. And so 50 organizations came together over a 1.5-year time period to co-create what ultimately became the Gender Nutrition Action Agenda. And it's a first of its kind global framework of concrete actions to improve women and girls' rights, advance gender equality, and improve their nutrition. So very much combining gender and nutrition and the intersectionalities that affect gender and nutrition. And this was officially launched last year in July at the Women Deliver Summit. And in the closing memo from Women Deliver, it was noted as one of the top 5 important things that happened at the Women Deliver Summit. So we were very happy to see how much that resonated with particularly the gender community. And what I'll land on finally saying about this is that what we tried to do with this action agenda is to create a blueprint for achievable solutions. And it prioritizes key action areas, including healthy diets, care, gender equality, and the importance of a supportive multi-sectoral policy environment. And it's a call to all actors to re-energize previous commitments and reposition nutrition as a feminist issue, and critically to come together to prioritize actions through a gender transformative lens. And the key principle in all of this work is that it requires us to take steps to empower individuals, transform gender and power relations, to support gender equitable structures, systems, fairness, and justice in the distribution of rights, responsibilities, and resources between women, men, and gender diverse people according to their respective needs. And ultimately, what it's all about, and importantly for this webinar and the group of people here, is our work in knowing that community-driven approaches are the heart of this, and that the collaboration and long-term partnerships are critical in the journey to empower women and girls, transform gender relations, and build gender equitable systems. So while we're talking about nutrition in particular, it's absolutely at the heart of this is gender equality. Thank you.
Thank you so much, Dr. Ash. That was wonderful. We're only one question in and I'm already feeling very fired up and excited. So thank you all so much. My next question is going to be the same for all of you, but we can go in the same order. So this one will go first to Anne. Now that we've heard a little bit more about what you do work on and do, can you share what is the biggest misconception about your work or how gender shows up in your work?
Thank you, Dorothy. Great question. My other panelists are incredible, and the work that they're sharing, I think, intersects really well with the work that we're doing. And I touched on this a little bit previously, but I think a misconception is that we are just doing healthcare. But we really have to build communities that are worth living in. A lot of our community members are leaving their communities. They're looking for work. They're looking for livelihood in the United States. They're looking for different options because Guatemala is very hard. It's hard to live in. It's hard to find a way to make a living. And it's hard to get access to healthcare. And one of our key pieces is that we need to build communities that are worth to stay in, that are worth to be a part of. And access to healthcare with dignity and respect in their language and culture is absolutely vital. And I think a misconception about healthcare is that we just need to give quick answers. But this is something that takes a long time. We've been doing this for 17 years. And we can see that through community and human-centered design that Hilda talked on, what Dr. Ash was really pointing at, that it's absolutely vital that gender discrimination is something of the past and that we really focus on creating healthcare that is accessible for all. Something that we've been doing over the past few years is really helping to influence the government policies on health to make sure that healthcare is available for everyone. It's delivered in a fair and just way. This takes a lot of time, but right now with governmental changes in Guatemala that are taking place exactly in this year, we see that there's a real hope and future for community care driven by nutrition work. Unfortunately, Guatemala has the highest rate of malnutrition in the Western Hemisphere. And that's something that's not well known and something that needs to be addressed immediately. So in communities here, more than 70 to 80% of Indigenous children are malnourished. And that is something that has to be addressed. It has to be an international issue that little girls and little boys can have access to healthcare and proper nutrition. And something that I think is also really key to our work, and it's something that we ourselves have discovered over time, is leadership training. We work really on the grassroots front of our care. We work closely with our communities, closely with women in our team. And something that's really important is providing training, especially for Indigenous women, leadership training where they can learn to support their communities, how to be a manager, how to be a thoughtful leader, how to dare to be a leader. how to fundraise, how to do contracts, be an HR leader and do budgets, things that in our communities here in Guatemala, women did not see growing up. They're not experiencing in their home. And if they're going to change their communities and be grassroots leaders, they need to have access to the training. I'm grateful to Together Women Rise, who've helped support this work in training Indigenous women to change their communities and change Guatemala. But I think when you think about healthcare, you don't think about leadership, but it's absolutely fundamental that you can have women leading the front of healthcare here in Guatemala that are Indigenous and that understand their communities. And I think that is absolutely vital and a great misconception that really healthcare involves the entire community.
Excellent, thank you. Same question to you, Hilda. What's the biggest misconception about your work or how gender is showing up in that work?
Yeah, for the misconception in our work is based on the people's perceptions, especially once you are working with the government. For example, I can talk with examples. For example, if you are working with the government and you are helping them on the development of the policy and regulation and standards, so the standard regulations are there. So if are there, they think that is enough. So sometimes it's become very difficult for us as an advocates for the implementation, because we have the policy, we have the regulations, but the implementation or the intervention or how can we work on the depending on the policies that we have, it become very difficult during the implementation. So the misconception is there is a policy, there are standards, so that is enough for them. But for us, we think that is no. We need to think beyond that. The policies are there, but are we following the policies that we agreed on? Are we following the regulations and the standards that we are, especially on the food fortification, especially on depending on the project that you're working on, especially on we have the multi-sectoral accountability framework in there. So are we working depending on the document that we have? Or it is enough that we have the document there and no one is taking any initiative to take it forward for the actual work to be to take place. Another thing is sometimes the misconception is on the people thinking. People think that maybe these advocates, they want attentions. We want attentions on depending on the issue, but no. From our side, before we are doing anything, we have to do the landscape analysis and see if that will add value, or if that thing that you are working on will make any impact to the community. And also come up with the right action to be done at the right time. So there are some misconceptions on the work that we are doing, especially once we want to take action or to move further from where we are coming from. So that is what I can say so far.
Thank you so much, Hilda. And I loved what you said there at the end, the right action at the right time. I think we've seen how, attempts to do good can sometimes backfire and cause harm. And that's why it's so important to be always checking in with the communities first and taking their lead. And now to you, Dr. Ash, the same question. What's the biggest misconception in your work?
Great, thanks. Yeah, it's a wonderful question to really highlight some of what we contend with. And I'd say that one of the ambitions in doing this work is that we wanted to make sure that we were elevating the gender nutrition gap as equally important as what we talk about in the zeitgeist about the gender pay gap, or the gender tech gap, or the gender pension gap, the gender education gap, that actually the gender nutrition gap is a gap. It's one gap that creates many when we look at the impact that it has on girls and women's lives and livelihoods. And so one of the things that is something that we had to work on, especially, is how do you communicate about this in a way that conveys that it is in many ways, yes, complicated, but also simple to do something about it. And at the same time, to not lose the focus that it's devastating, but it's at the same time preventable. So the way that we were able to find a way to create a narrative around this is that, yes, it is complicated. It's about food and nutrition, but it's also about biological needs. It's about cultural and social norms in equal manner. It's about poverty and government priorities and a lack of political will. And like those other gaps that we just mentioned, it's also about systemic failures and how one gap does create many. It's about feminism, rights, and conflict. And it's also about the climate crisis, justice, and freedom. So there's a lot in that mix, but at the same time, we stay focused on, ultimately, it's about nutritious food and who eats last, least, and worst in the world. And it's about mothers who sacrifice when food is limited. It's about a lack of equality in household finances, decisions, and expectations. It's about girls not being able to concentrate at school due to malnutrition. And ultimately, what we know about a 10% reduction in their lifetime earnings because of that. And again, in terms of devastating, I was mentioning those statistics are quite devastating. It's about suffering and it's about death, unfortunately, and it's about dangerous consequences for the health of mothers and babies and an increased risk of hemorrhaging during childbirth, for instance. But it's also about well-being and quality of life, and it is preventable. It's about dedicated budgets from governments and specific nutrition policies. And again, that was the aim of having this collective action towards creating an action agenda that creates a common ground across sectors and across actors. And very importantly, as we've just heard from both Anne and Hilda, it's about the allyship of men and equal political power. It's not about separating out. It's about actually overall changing our beliefs about the role of women and girls and the accountability in all of this. And so where we land is that we know it's complicated, but yet it's simple, it's devastating, and it's preventable. And so when we have found that even when we are working on this in multiple countries, right away, people will say, well, what about the men and boys? And absolutely, it's also about the men and boys. It's that we're showing that there is a real and disproportionate effect on women and girls, and we're absolutely embracing whole of society. So that's, I would say, probably one of the misconceptions when talking about a gender nutrition gap that's affecting girls and women, is that it somehow seems to be overshadowing girls and men, but it really is a whole of society view. Thanks.
Thank you all. Those were amazing answers. And now we're going to sort of be wrapping up, but a little bit of context for my last question. So here we have over 150 lines dialed in, and a lot have more than one person listening. We'll also be sharing out the recording, and over the next few months, Results volunteers and supporters are going to be out in the community organizing and educating people about these issues and inviting them to come to lobby meetings, come to group meetings, come to webinars like this to learn more about these issues in the world. And so we plan to have hundreds of meetings with members of Congress in the next few months. And if there was a message that you would want us on the call to take away in 60 seconds or less that we could communicate with US policymakers, what would that message be for you?
Thank you, Dorothy. That's really hard in 60 seconds or less, but I think it's so important. And I'm going to take two pieces from my other panelists, Dr. Ash and Hilda. And I think one key piece that Deborah said was, who eats least and worst in the world and who eats last. And I think if we want to build communities worth living, we need to feed our children. We need to feed the women in our communities. And seeing the high malnutrition in Guatemala, it's absolutely vital that we are creating these communities from the ground up. And if we're going to actually change the long-term outcome for the development of humans, it's those first few years of life when our brains are growing the most. We have to feed them, and we have to provide children with the nutrition that they need. And the work that Results is doing right now to push forward Gavi and to push forward the initiatives around women and children's maternal health and nutrition is absolutely essential. And I think Hilda hit it exactly on the head, doing the right thing at the right time. All over the world, we can see that this is absolutely a fundamental need. And here in Guatemala, the time is right now. With the change that has come with the government and Bernardo Arévalo taking over as president, there is no better time to make change here in Guatemala with a president who is open. And I think that's absolutely vital, that the United States and that the work that we're doing, both locally and internationally, can have broader impacts, because we're trying to create these communities where people want to live and they want to survive. So I think that's absolutely fundamental, is what Results is pushing forward right now.
Great, thanks, Anne. Over to you, Hilda.
Yeah, I think that is a very difficult question for me, but I will go for the investment in preventive medicine, or for the prevention rather than a curative. So if we want to prevent any diseases, we need some strategies, the investment on the prevention medicine. That is what I can say so far. So for me, I think the agenda that I will advise them to take to their senators, it will be investment in preventive medicine, because over all of the things that we are talking about, if we work very hard to prevent them, I will have a very good communities with a healthy community and all that. So that is me. Yeah.
Thank you. Over to you, Dr. Ash.
Yeah, thank you. Yeah, so I think what we would emphasize is the intersectionality, so that the goals of women and girls' rights and empowerment agenda and the global health and nutrition sector are mutually reinforcing. That we need to work together to continue to reduce maternal mortality, reduce low birth weight, stopping early marriage, increasing the female labor force, improving child health, and driving social norm change. All of these are interconnected. And fortunately, 50+ organizations have come together to co-create this gender nutrition gap action agenda. And it gives us a global framework of concrete actions to improve women and girls' rights, advance gender equality, and improve their nutrition. And what we know is that it's critical to embed the global nutrition gap policy actions into donor and philanthropic strategies and prioritize investments that can lead to tangible and lasting change. And also let them know that there is a guide to do this, a companion piece to the action agenda called Nourish Equality. And this is a much needed practical guide that provides the how-to for investments in this area. So we've presented the evidence, we presented this globally agreed framework, including coming from partners in the UN. And then we also have this investment how-to guide. And so hopefully that kind of package can be very appealing to make decisions and investments in this area. Thank you.
Wonderful. Thank you all. And now we have the opportunity to go to a few questions from the audience. So thanks to everyone who's been sending those in. And I've just noticed as the panel has been going on, there's been a lot of good responses in the chat and people are really connecting with what you all are sharing. So thank you again. My first question is for Anne. Are there gender roles within the communities that you work in that act as barriers? And if so, how do you address those so that the interventions are addressing maternal and child nutrition and issues, and they are culturally embedded, but they're also pushing towards that whole of society approach that we've talked about?
Great question. Yes, it can be very difficult here in Guatemala. There's a lot of machismo, or really the idea that men are above women and that men own their wives in many ways. And it can be a real barrier, especially when we look at maternal health. Sometimes when we identify preeclampsia in a woman that is pregnant, we need to send her to the hospital, but it's very sort of a silent symptomatic situation. And it's something that we're detecting through blood pressure. And sometimes the husbands will say, well, I don't want them to go. They need to stay. They need to help take care of my other children. And we need to explain to them. And really it comes through involving some of our peer male educators that we've brought on board. And that's really been key in working with the community development groups that are mostly run by men, and the mayors and the auxiliary mayors, things like that, where we have men teaching men about women's health, about human development, about sexual reproductive health. So I think it's really key. It's a slow process, but it's really key to have men being a part of this story too. We cannot only teach sexual reproductive health to women.
Thank you so much. My next question will be for Hilda. What opportunities do you see to include vaccination in sort of this broader package? Do you see a lot of these same dynamics with nutrition, with maternal health as in your work on vaccination?
Yeah, yes, I can say that I can see some opportunities on vaccination, especially at the immunization for the children, and also for our countries, we have some immunization schedule for the under 5. So, and not all of the children get immunization as scheduled, depending on the availability of the immunizations, and also the knowledge gap that women's or families or relatives have on the appropriate vaccination, because there are some, I can say there are some misconceptions and myth on the immunizations. So there are some areas we can find a way to work on the vaccination. And as Health Promotion Tanzania, we are not that in a vaccination angle, but we can see that there are some challenges depending on myth and misconceptions, and also the availability of the vaccination at an appropriate time, depending on the age group of the children and so forth. That is what I can say.
Excellent, thank you. And then this question, I'm not sure if any of you have experience with school feeding programs, so potentially could opt into this one, but if not, then Eugene, we can follow up with you offline with some more information on this. But what role, or do you all see a role of school feeding, for example, the McGovern-Dole International School Meals Program from the US? Are programs like this that give kids food in school having a positive effect in the community, or how are those playing out with the folks you work with?
I can quickly touch on what happens here in Guatemala with school feeding. Often there are school feeding programs, but they're really lacking in the really whole spectrum of nutrition that children need. They're often soy-based products or corn-based products, and they provide some nutrition and some feeding, but they're often heavily with added sugar from the community members that are making these products for the kids. And so oftentimes it's not providing really all the nutrition that they need. But oftentimes what we're really working on is the 0 to 5 and often 0 to 2, 2.5 range, which schools programs do not hit. And when we really want to hit that brain growth, when we're looking at chronic malnutrition over time, we really have to focus on that key 1,000-day window.
Great, thank you. Well, I think possibly this is going to be a hard question to end on time-wise, but if, in a couple sentences, how do we get government leaders to understand that we need communities worth living in? Or could you share, what do you see the importance of US advocates for these issues being? And that could be to any of you. don't all jump in.
Yeah, it's a
That's
really,
a tricky one.
it is a tricky one. I'll
Much
jump
tricky
in.
one.
I'll jump in quickly. You know, when we look at US policy versus international policy, it's hard to put our finger on what can happen, but I'll just give a quick thing that has recently happened within Guatemala. And, you know, there was a real struggle in power here in the last 8 months when the new president, who was elected by indigenous communities and elected by the youth here, and he's real progressive and a very different kind of change of guard here. And the old guard did not want to let the new president come in. There's many protests. It's been a difficult 6 to 8 months here. But the US policymakers actually took away over 300 visas of Guatemalan congressmen and people working here. And so working in government, and they influenced policy that actually created change within Guatemala's leadership. And so the new president is here. You can see US policy and the government here in Guatemala working well together. And it's really an example of what can happen when proper pressure is applied. And I think when, you know, all of this really started because a few indigenous communities thought they could do it, and they thought they could make change. And that spread over an entire country of 18 million people being aware of their democracy, you know, being at stake. And I think when it just takes a little bit of us applying pressure, we really can do a lot.
Wonderful. And that is a sentiment that I really love about the results movement, and what continuously sort of fills me up and keeps me excited about this work is being in a community that is committed to changing the world and saying, you know, what we have now is not the best we can do, and we're not going to stop here. And so I think a big takeaway for me, and something that I think a lot of us are going to spend the next few months really building on, is how can we use our voices and take the message to our members of Congress that we need livable communities everywhere, that we can let them know that we care about these issues because they're human rights. You know, the world can feel like there's a lot of problems and there's so much to fix. Where do we start? And knowing that we have, you know, amazing experts and partners like you and dedicated advocates makes me feel like it is really possible. So thank you all so much for your time and your expertise on this Saturday. And I know it's evening for you, Hilda, so thank you so much for your Saturday evening. And I hope that you all are going to stay on, because now we're going to get a little bit more into action. I'm going to pass it over to my colleagues on the Grassroots Impact team, and they're going to walk you through how you can do outreach in your community around these issues and opportunities to use your voice for maternal health coming up in the next few weeks. So with that, I will pass it over to the Grassroots team. Thank you.
Thank you so much, Dorothy, and to our panelists, Ann Kramer, Hilda Quasey, and Dr. Deborah Ash, for your incredible work, your insights, and sharing with us how we can use our advocacy to make positive change for women and children worldwide. Hello, everyone. My name is Corinne Burry, and I'm a manager of the Grassroots Impact team at Results. Before going into the next part of the agenda, where we'll share action steps following this incredible panel, we'd like to know who's in the room with us today. So we'll be launching a quick poll. Please reply and let us know if you're logging on solo, if you're in a pair, or joining us in a group. And we'll give you a minute or so to respond.
I think the whole question changed. 1 second here.
Oh.
Sorry, we're asking the wrong question here. My apology.
I think Ken's about to launch it again.
1 second here. You can go ahead for a second here, and I will. I'll be right with you.
All right. So I also wanted to give a big thank you to those of us who are joining us from our extended networks with Together Women Rise, our partnership, and other partners who are joining us today on the live stream. We're really excited to see the amplification of this message and the actions that we'll be taking together. Oop, I think this poll might be
Yeah, I
from
don't know that we're gonna be able to-
our policy
not-
forum.
I think it's gonna hold us up, Karen, my
All right,
apologies.
so let's keep going. Let's keep this party going. Next slide. So I wanted to take a moment to share how we'll work together now that we're empowered with facts, data, stories, and shared experiences to take the advocacy actions that'll make a difference for women and children globally. This Friday, March 8th, is International Women's Day, and it gives us an opportunity to bring attention to our members of Congress of the critical issues that women face here in the US and globally. As Gloria Steinem said, that the story of women's struggle for equality belongs to no single feminist, nor to any one organization, but the collective efforts for all who care about human rights. So we all must play a part. Next slide. As a follow-up specific to today's national webinar, we're making a call to our senators and representatives that while they're still in the process of finalizing the budget for our current fiscal year and avoiding yet another shutdown, the time to make decisions for next year's budget is upon us. The appropriations process is when our elected officials hear from you, their constituents, to determine where our taxpayer dollars go to support critical programs, such as the Global Fund to Fight AIDS, TB, and Malaria, as well as programs run by the United States Agency for International Development, known as USAID. These programs support maternal and child health, nutrition, vaccines, and education. And if you're brand new to advocacy, or perhaps you've never engaged with your elected officials before, we'd like you to consider taking this action with us on Friday, March 8th. This online action will give you the guidance you need to write a personalized message to your representative and even a script to call their office. Demand that they don't just tell us what they value, but that they show us that they value the lives of women and children through their budget decisions. We're asking for $1.15 billion for maternal and child health, which includes $340 million for Gavi, the Vaccine Alliance, and $300 million for USAID nutrition programs in fiscal year 2025. This will give us the opportunity to continue the gains that we've made through targeted interventions in health, especially in supporting Gavi, which has prevented more than 17.3 million child deaths since 2000, as well as addressed acute malnutrition. And our chat monitors will share the link to that action in the chat. For those who'd like to deepen their advocacy actions or are interested in doing more, we encourage you to continue reaching out to your members of Congress between now and April to request lobby meetings. We cover nearly 350 members of Congress, so let's make it a goal to meet with every office. This will give you the opportunity to make these appropriations requests face-to-face if you can meet with the member directly, or even more importantly, to the aides who cover the issues for the member. The opportunity to develop that relationship is extremely valuable, and we have resources to support you in making those requests on our website, and you can even request lobby prep support by reaching out to my colleague, Katie Fleischer, and we'll drop her email into the chat. Be sure to amplify this action by inviting new advocates, warm leads, results fellows, seasoned advocates, as well as partners to join you in solidarity. The more constituents members of Congress hear from, the more that this deepens our impact. Next slide. Take an even deeper action by contacting your member's office as soon as next week to officially submit your budget requests through their online forms or other specific submission processes that they have. A lot of these deadlines are coming up soon, so be sure to request the deadline for them to receive appropriations requests from constituents to make sure everything is sent into their office on time. With this, your representatives in Congress will be able to chime in and share what their constituents have requested from the State and Foreign Operations Subcommittee on appropriations when it comes time to decide on the budget. We've also got resources to help you complete these forms for FY25 appropriations requests on our website. A link will be shared for that in the chat, and my wonderful colleague Katie can also help you with submitting these requests. And with that, I'd like to thank everyone for your collective advocacy actions, your current advocacy actions, and your future actions that'll help shape the world for a better place where no matter what our gender is, we can all thrive. With that, I'd like to pass it over to my colleague, David Plasterer, who will share our U.S. poverty policy update. Over to you, David. David, we can't hear you. You might be muted.
Yep, I needed to be unmuted.
Oh, there you go.
Yeah, thank you.
Welcome.
Yeah, thank you, Corrine, and thank you to our wonderful panel and everyone who's spoken today. I know this has been a really great webinar and truly inspirational. Thanks everyone for being here. I'm David Plaster. I'm the Senior Associate for U.S. Poverty Policy and kind of your go-to guy for all things child tax credit. I have a few minutes here to give you a quick update on where things stand in Congress regarding the child tax credit. But if you have any questions I don't cover here today, always feel free to contact me with an email or on the phone. I always enjoy talking to you and messaging with you. And so first, as you probably already know, the House passed the Tax Relief for American Families and Workers Act with a huge bipartisan vote of 357 to 70. The bill passes. The bill pairs meaningful changes to the CTC with along with some tax breaks for businesses. That vote was a huge victory and a testament to your amazing advocacy during 2023 and 2024, and your efforts to educate members on how flawed and insufficient current CTC law is. Without your work, we would not be where we are today. So thank you so much. The bill is now with the Senate, where it faces an uncertain path to passage. Currently, there's unanimous support from Democrats in the Senate, and there are 7 Republicans who have indicated publicly that they support the package as well. However, there are also as many as 7 to 10 Republicans who have indicated privately during meetings that they are also supportive of the bill. However, the ranking member of the Senate Finance Committee, Mike Crapo, has voiced some serious concerns with the bill, most recently in a statement he released Thursday morning. And that statement is linked in the slides. And so if you want to read his full statement, it'll be linked in the slides for you there. But his biggest concern that he outlines in that statement, and one that's shared by many Senate Republicans, is with a certain provision in the CTC called a look back. Now, the look back allows families to use their prior year's earnings to determine their credit amount. Opponents say this removes the work requirement from the CTC and will disincentivize families from working. We, of course, know this isn't true, and there are many economists, conservative economists, and policy analysts who agree. And so if it would be helpful for you in your advocacy to have links to all of those economists and policy analysts, just shoot me a message and I'll send you a whole list of them. Now, while Senator Crapo's statement was not at all helpful to our goals, it does illustrate that what we are doing is working. He would not have released that statement unless he was hearing from many of his members on the Senate Finance Committee and across the Senate that they want to see this bill passed. The statement really was geared at those members to let them know where he stood. And so it's in some ways a good sign. But what does all of this mean for the tax package's chances of actually being passed? And so there's 2 possible ways for the tax package to be passed in the coming weeks. First, the tax package could be attached to a government funding bill that's due to be passed on March 28th. This would require agreement from the leadership of both parties. And obtaining that agreement would likely require the Senate Finance Chairman, Ron Wyden, to schedule a committee markup during which amendments could be offered. And some of those amendments could weaken the CTC. For instance, this is where Senator Crapo would seek to remove the look-back provision that I just talked about. Another option is that Senator Schumer, as the majority leader, could just put the tax package on the floor as a standalone bill. And, even though I already mentioned that there's a lot of support, enough support, frankly, to pass the bill, that support would dramatically decrease if the bill was put on the floor without the blessing of Leader McConnell and Senator Crapo, which would be unlikely that Senator Schumer would be able to get that blessing. And so, even though the path for this bill to be passed is unclear, we don't really need to even worry about any of that. we just need to ask and see, we just need to see the tax package passed in any way possible and as soon as possible. And so that's where your advocacy comes in. You can contact your senator today. You can use our online action tool or send an email directly to your tax staffer. And if you schedule a meeting, please let me know. I would love to connect with you to help you prepare for your meeting. There's also a nationwide day of action next week that is happening among a lot of, there's a whole coalition of organizations nationwide that are working to expand the child tax credit. And we've decided on Tuesday, March 5th, as a nationwide day of action. And so that's a wonderful day for you to call your Senate office. And we will be sending out an action alert on that day. And so you can be ready for that. But we also need to build pressure through the media. The tax season is nearing its end, and families need this bill to pass now so they can take advantage of the expanded benefit in their 2023 tax filing. So submit an LTE using our online CTC media action. And if you have any questions about anything I've shared today, or how you can make sure that more families receive support from a child tax credit, please contact me. I'm always here for you. And with that, I will pass it over to Keisha for some announcements. Over to you, Keisha.
Thanks, David. Whew, I don't know about all of you, but I am feeling so energized from this incredibly powerful and compelling webinar that we've had today. Just so much phenomenal information and actions and quotes that I know that I'll be thinking about for the rest of the day. And I know we had a bit of a technical glitch with the poll earlier, but now, thanks to Ken, we are back in action. And we'd love to know who is in the room today. So you should be able to see a poll on your screen. So please respond to that and just let us know if you're joining us today solo, in a pair, in a group, however many people are with you, so we can get a better idea of how many people were on today. And I can already see so many responses coming in, and it's so exciting to see so many people on that got to hear that amazing panel and all of the actions that we'll be able to do this month. We'll wait a little bit for those responses to stop coming in. Awesome. So I just want to thank you all for filling that out. And we'll leave it up just a little bit longer. And then we're almost done for the day, but before we end our time together, I am going to highlight a few exciting events that we have coming up. But awesome. So in about 2 weeks, on March 14th, Results and Results Educational Fund Grassroots Board will be hosting their next town hall at 9 p.m. Eastern Time. And this town hall will be a chance to focus on crafting and practicing your story of self and talk about the value that you get from being a results volunteer. And this is the perfect time to strengthen your skills around developing your story of self as we continue our outreach efforts this year and build our community of change. And there's no registration required to attend, so you can just hop on that Zoom that night and have a good time. And then the next thing I wanted to share, the day after the town hall on March 15th, we will have our next anti-oppression learning community meeting. Results Anti-Oppression Learning Community comes together 3 to 4 times a year to offer a brave space for grassroots to have conversations on anti-oppression topics. And in this month's learning community meeting, Dr. Christina Gunther, the same person who does our diversity and inclusion trainings, she is going to be joining us to lead a discussion around the topic of gender equity in health. So to build off of today's fantastic webinar. So everyone is welcome, and there's no limit to the number of people who can register for that. So we hope you'll join us to be able to take some of the content today and really have a fantastic discussion with each other about it. And then the last training I want to really emphasize is a training that we have coming up on Monday, March 11th, on pulling off effective congressional meetings. You'll get best practices for everything you need to have successful meetings, including requesting, planning, holding, following up, which is perfect timing as you continue to set up lobby meetings. So bring all of your questions and your concerns, and we'll make sure you leave confident in your ability to have great lobby meetings going forward. And there's a bunch of other webinars, as always, lots of trainings and support and partnership calls that we have every single month that I'm not going to go over, but there's a little something for everyone. So check those out. And I know I saw some folks in the chat asking about, do we have recordings? Do we have slides? And the answer to that is yes. If you didn't catch everything as we went through the slides, if you're looking for those registration links, you can always download the slides from our website on the National Webinars page, webinars and training resources. And you'll also find the recording and things there. And then there is also the events page. That's another place you can go to always see what different events we have, find all the links to register. So you can always check that out too. And last, but certainly not least, don't forget to show up to next month's national webinar on April 6th at 1 p.m. Eastern Time, where the founder of Results, Sam Daly Harris, will talk about reclaiming our democracy. So another powerful webinar we've got coming up the pipe for y'all. Thank you all for joining us today, and Ken will allow everyone to unmute, and then we can all wish each other a great weekend. Thank you all again for coming.
Goodbye, everybody.
Bye.
Stay.
Bye. Roger.
Keep up the great
Bye.
work, y'all.
Bye. Have a great day.
Appreciate everybody.
Everyone.
Happy trails.
Happy
trails. Good mom.
Bye.
Just know.
Thank you, everyone.
Thank you.
Thank you, everyone.
Thanks. Nice to see you all.
Thank you, Gary.
Great to be with you all.
Bye, Peter.
Results.
Bye.
Bye.
Bye-bye.
All right.
Hi, Peter. Hi, Bill.
Hi, Roger. Hi, Alan.
Hi.
It's, see, Roger, I just heard.
Not my gray square, but it's that. Speaking of your book club.
Hi, everyone. See you, Beth. Hi,
Look, I
David.
got Rich here.
Yeah. Oh, I'm going to ask you about my Senator Wyden, David. Maybe I'll have a conversation if there's any communication that I can do with him later.
Okay. Yeah, I mean, he's obviously hugely important. And so, yeah, happy to connect with you on that.
Yeah, we can think about that together. Okay. Thank you so much, everyone. Bye-bye. Have a good afternoon.
Bye. Thank you again for inviting me for this. Really enjoyed meeting you all. Thank you.
You're great, Deborah. Thank you so much for everything.
Yeah.
Sure.
Nice chapeau, Ken.
Peace Corps. Peace Corps. All right.